Before entering the patient's room, I went ahead and checked her chart, make sure that she had orders on there that we could go ahead and suction, and check the doctor's orders and the patient's name and patient's history and everything. Upon entering, I knock on the door. Hi, Mrs. Smith. My name's Kate from Respiratory, and today it sounds like you're having a hard time breathing. I'm going to help suction some of that stuff up that's hurting you to breathe. So I would already have my suction canister. I go ahead and set it up, wash my hands, put on some gloves. Then I'm going to assess the patient. Mrs. Smith, do you mind if I listen to your lung sounds? Just take some normal breaths for me. You can hear that she has a lot of crackles and congested here. So suctioning is a sterile procedure. For an adult, you're going to do suction is going to be set up to -120 to -150. And so after monitoring my patient and her vitals, I'm going to go ahead and grab my sterile catheter tray. And upon opening it, it's a sterile procedure. So I'm going to go ahead and my left hand is going to be my clean hand. You're going to have one clean hand and one sterile hand. My right hand will be my sterile hand. So I would go ahead and have some gel here, and I'm going to go ahead and grab the nasal trumpet and make sure that it's lubricated well. Mrs. Smith, I'm going to go ahead and give you some oxygen before we do this. I'm just going to insert this nasal trumpet into your right nostril, and then we could go ahead and suction some of that stuff up, okay? You'll feel a lot better when we're all done. Now that my patient's hyperoxygenated, I'm going to make sure that the bevel is facing the septum. I'll go ahead and insert 1, 2, 3. Okay. And now, with my right hand, I could go ahead and grab the sterile suction. I'll go ahead and hook it up to the suction, or to the canister in the wall, insert some saline into my tray, and now I'm going to make sure that it's suctioning. Looks good. Make sure that it's nice and lubricated. And on the count of 3, I'm going to go ahead and insert 1, 2, 3. And we want this to take no longer than 30 seconds or 15 seconds, quite uncomfortable for the patient. Now that I feel some resistance there, I'm going to back up a little bit, occlude my thumb hole, and suction out. Okay. After doing it, just after once, I'm going to go ahead, put this back in my sterile tray. I'll hyperoxygenate the patient, assess the patient, make sure that her SpO2 is maintaining that to see if she needs suction again. If she does, then I can go ahead and repeat doing it if she's stable. If not, we can wait a little bit and then wait till she recovers and then go ahead and try suctioning some more out. It might take several times if she has some thick mucus in there. Thank you, Mrs. Smith, for your time. We're going to go ahead and leave that nasal trumpet in so we don't have to take it in and out each time. It sounds like we might have to wait till you recover a little bit from that, but we'll help you get some of that, all that stuff out.